We are speaking today with Dr. Jeffrey Weiss, Executive Medical Director of the Southern California Permanente Medical Group. Since 2004, when he began his role as Executive Medical Director, Dr. Weiss bears the ultimate responsibility for medical care provided to more than 3 million Kaiser Permanente members in Southern California. Dr. Weiss, can you please explain the history of the colorectal cancer screening program at Kaiser Permanente, Southern California?
Prior to 2006, Kaiser Permanente used a lot of initiatives to screen for colon cancer, such as colonoscopy, sigmoidoscopy, barium enema, and guaiac stool testing, really called GFOBT. In spite of our emphasis on this, we were only able to screen 49% of our targeted population.
Why were your screening rates historically so low?
The guaiac fecal occult blood test was sort of cumbersome. It really wasn't patient-friendly. It required 3 separate stool samples. You had to change your diet. You couldn't eat red meat. You had to avoid aspirin-like products. You couldn't take vitamin C. And people didn't really want to bother. They thought it was too much effort.
Your screening rates began to increase in 2006. What was the impetus for this change?
Our colon cancer screening rates started to increase significantly since 2006 when we started using the new fecal immunochemical test.
What is so revolutionary about the new fecal immunochemical test?
The new fecal immunochemical test, called FIT, is much easier for patients to comply with. It detects microscopic blood throughout the intestine. It's more sensitive and specific. It's a screening test that's known to detect cancer and can save lives.
So it is an easier test for patients to take, and it yields better results. How did you implement the screening program?
We recommend that our patients have the test annually or biannually so we can detect cancer at its earliest stage. Kaiser Permanente took the initiative to target a population between ages 50 and 80. We mailed these kits to their homes. We followed up with an automated phone call to make sure they were going to comply. And since 2006, we've screened over 640,000 members with the new fecal immunochemical test. It's quite an achievement.
What did this do to your screening rates?
We're thrilled to see that our screening rates have increased from 49% in 2006 to over 70% in 2009. That's almost a 50% increase.
Incredible. Since 2006, when you began implementing the new FIT test, you've screened over 640,000 patients. What other types of significant changes have you seen?
We've seen an increase of 28% in early detectable cancers and precancers. If we can find it early, we can treat it early and save lives.
You are detecting more cases of cancer earlier. Has this early detection had an effect on your late-stage cancers?
With our early detection program, we've seen our stage 4, our most advanced type of colon cancers, decrease by almost 30%.
That number is astounding. You are finding 30% less late-stage cancers and ultimately saving lives. Would you like to see other hospital systems instituting more preventative healthcare methods?
Preventive care is critical to the future of the American healthcare system. We need to focus on a healthy lifestyle and preventing people from getting sick.
Dr. Weiss, you are very passionate about colorectal cancer screening and the hugely successful program at Kaiser Permanente, Southern California. You are saving lives, and you are also saving money.
Cancer of the colon and rectum is one of the leading cancer deaths in America. So why not focus on it and try to prevent it and save lives? Last year we spent over $150 million on chemotherapy to treat advanced colorectal cancer. If we can detect cancer at its earliest stage, we can prevent patients from undergoing chemotherapy, radiation therapy, and advanced surgery. Isn't that the experience you would want if you were a patient? Isn't that a better way to use our healthcare dollars?